All right, so let me jump in. My name is Jessica Lehman. I'm the Executive Director of Senior and Disability Action, and we organize seniors and people with disabilities to fight for change in our communities on all the issues that affect our lives. And I'm really proud to be here today as part of the California Care Rationing Coalition, which is an incredible coalition of some really powerful folks from around the state, from senior groups and disability groups and other advocacy groups and individuals who want to make sure that all of our lives are valued. So one of the things I was thinking, there was a headline that really hit me about a month ago now, I believe, that said, COVID only affects older people. And then they said, only with a question mark. And it was this realization that for so many people, it seems okay if older people die, or at least it's much less terrible than younger people dying. And those of us who are older or disabled or both live daily with ableism and ageism, which I would define loosely as oppression or discrimination based on disability or age. And we experience people pitying us, people assuming our lives are miserable, doctors and health professionals assuming that we won't live very long. We deal with lack of access or people refusing to hire us for jobs. And suddenly it is clear how those stereotypes are literally killing us in the form of care rationing. We're seeing care rationing in terms of how do we either consciously decide who gets care for COVID-19, and in the unintentional ways that we either provide or don't provide good mechanisms for prevention, treatment, and care for older people and for people with disabilities. So we're here today because we are at a real deciding moment in California regarding COVID and regarding how we think of older people and people with disabilities. So very soon this week, or next week, Governor Newsom may act on a request for immunity from the nursing home and the healthcare industry, saying that if they make a mistake, if something happens, that they will not be held accountable for that. In addition, we are in this momentous moment of the state working on care rationing guidelines about if there are not enough hospital beds, if there are not enough ventilators, who gets care and who gets care first. These may sound like separate issues, but they are both about the direct impact on the lives and deaths of seniors and people with disabilities. So today is about changing that process to include senior and disability communities. We are not just asking to be cared for, to be paid attention to. We are demanding that our voices and experiences be heard, that we are the ones to improve policies and save the lives of our community members. So I really thank all of you for being here today to hear those voices and to report on these life or death issues.